Welcome to A Place of Our Own. I'm Debbie Gutierrez, and thanks to this letter from Regina Romero in Tucson, Arizona, we're focusing on how to prevent dental disease, a silent epidemic that's impacting millions of children each year. Regina writes, "Dear Debbie, my baby's first teeth are coming in. How important is it to start brushing them now? Since they are baby teeth, do I have to worry about them?" Joining me with some answers, Regina, is dentist Dr. Valery Sweeny. Dr. Sweeny, welcome.
Thank you.
I'm going to be the first to admit I'm one of those moms that thought the baby teeth weren't very important because they were going to fall out.
Well, that's actually a very popular belief, but the baby teeth are very important because our children need their teeth to eat, to smile, to speak. They're very important. Besides, another important thing that not very many people know is that the baby teeth hold the space for the permanent teeth. And if you actually look at the X-ray, when you go to the dentist and you look at the X-rays, you'll see all the baby teeth are already, all the permanent teeth are already forming, and the baby teeth are on top. So you can see the teeth, and they're actually holding the space for the permanent teeth.
So the baby tooth is setting that space for the permanent tooth to come up. There's already a permanent tooth underneath
Right,
there?
yes.
And if this baby tooth isn't taken care of and there's decay, can there be permanent damage to the tooth underneath?
There could be permanent damage to the teeth underneath.
So at what age does a baby start getting teeth?
At 6 months of age, the child starts getting teeth.
And do we start caring for the teeth when we see one?
Yes, it's very important. We actually should start cleaning the gums and keeping the mouth clean even when before the baby gets their first tooth.
And how do we do that with a baby?
So for a baby, what we can do is just wrap the gauze around our finger, and then we just clean the gums, just wipe the mouth and the gums with this gauze.
Okay, and you can do that with a dry piece of sterile gauze?
Yes, that's fine.
And the same time I brush my teeth, you know, in the morning after meals?
Yes,
Okay.
exactly.
And at what age do we start taking baby to the dentist?
Well, it's said that at the first year of age, we should take the child to the dentist. And a good reason to do that is because even though nothing will be done, even though the child doesn't get a cleaning or a really formal checkup, the child will get accustomed to the sights, the smells, just the feeling of going to the dental office. And that'll set them off to have a positive note for the rest of their lives, because they'll have to go to the dentist for the rest of their lives.
That is really important to make it a positive experience because it's going to be twice a year that we're going to have to do this. Okay. And also, what are some of the symptoms of tooth decay?
Well, a child could have pain when they eat, when they're eating, hot or cold sensitivity. And that's another thing, that a parent doesn't want to be kept up at night because a child has pain. So besides keeping the child healthy, for them to eat, to speak, to smile, no parent wants to be kept up at night because their child has pain and not know what to do in the middle of the night.
See, now when my kids had pain in the mouth, I just went to assume that it was teething and nothing else.
Well, it could be because of teething, but it also could be because of tooth decay.
So tooth decay can give them pain as well and shouldn't be ignored.
Exactly.
Okay, great. And I wanted to ask you about some of the other things that you have here. I recognize, of course, the toothbrushes. What are you looking for in the bristle of a toothbrush for a baby?
Just a very soft bristle. And this is a very practical little brush because a parent can just put it on their finger and help their child to brush their teeth. And definitely when the children are very young, it's important to have adult supervision and make sure that they're brushing thoroughly and removing all the plaque.
Okay. And I wanted to ask, too, you also have here some fluoride tablets. Is that important for a baby to have?
That's important. If there's no fluoride in the drinking water, then it's important the dentist will prescribe fluoride tablets or also fluoride rinse that we have here.
Okay. And is this for baby, or do we wait for a certain age to start using the fluoride?
After 2 years of age,
okay,
it's used.
All right. Well, thank you so much for your advice. Now, I wanted to talk about one more thing you have here. You have toothpaste.
Yes.
At what age do we start using toothpaste?
Well, this toothpaste actually doesn't have fluoride, so it can be used as soon as a child has teeth. It can be used, just a small amount.
Okay.
And then when the child is about 3 years old, we could use fluoridated toothpaste.
Okay. And floss starts at what age?
Well, the flossing, whenever there's a contact between two teeth, the parent can actually floss the teeth in between, because the toothbrush will clean just the smooth surfaces and there will still be bacteria or some food caught in between the teeth.
Okay.
But the parent will have to do it.
Right.
As a child gains manual dexterity and is able to do it on their own, then they'll do it on themselves.
We have about about half a minute left in this segment. What are some of the foods to avoid, foods and beverages to avoid for tooth decay?
Well, any sort of sweets, sodas, candy, anything with sugar will cause tooth decay. Now, it's very hard to tell a child they can't eat candy or have sweets. So just as long as it's in moderation and as long as they brush their teeth afterwards, then it's okay.
And what are some of the beverages that might surprise us that contain sugar?
Sodas, some certain juices that have a lot of sugar, but sodas are very, they're very bad for the teeth.
Okay. And even milk and breast milk have sugar, so we
Yes.
need to wipe the teeth down even after feeding with a bottle and breastfeeding.
Yes, that's very important also.
Okay. Thank you so much, Dr.
Thank
Sweeny.
you.
Today we're discussing how to prevent one of the biggest silent epidemics among young children, dental disease. Joining us now with their advice are Donisha, Vertus, and Deborah. Welcome, ladies.
Hi, Deborah.
And still with us is Dr. Sweeny. Welcome back.
Thank you.
Okay, so how many children do you have, Donisha?
2.
2. And how old are they?
5 months and 2 years old.
Okay, so tell us first about the baby. How are you caring for the baby's teeth?
Well, what I do is take a wet washcloth and then just, gently wipe her gums down when she wakes up and then when we go to bed so that there's just no, milk residue left in her mouth and things like that.
Okay, and then your older baby?
With him, we have a special stool in the bathroom, and I let him use his special toothbrush and his special toothpaste because big boys brush their teeth in the mornings and in the evenings.
Right.
So as long as I'm like, okay, mommy does it and daddy does it, then he's like, okay, well, I want to do it as well.
Right,
And it
of
works
course.
great.
And Vertus, you're a child care provider. Is taking care of teeth part of your schedule?
Yes, it is. Every day at nap time, we all sit on our cots with a wet toothbrush and we brush our teeth together. So I have a rule they have to be sitting just so that they're safe, not running around with this thing poking out of their mouth. And then we sing a toothbrushing song about brushing the top ones and the bottom ones, brushing our tongue, getting the front ones and the back ones, and they're all doing it together. And then we get a drink of water to kind of rinse our mouth out before we lay down for nap time.
Wow, and the toothbrush song must take a few minutes, so they really are doing a thorough job.
Yeah,
and they enjoy it?
And I tell them that a toothbrush is a tool, not a toy. So we're not going to brush our fingernails and our toes with it. It's just for our mouth. And if I see them chewing on it, I'll take it away. This is a job to do. This is a serious thing here to keep our teeth clean. So.
And how do you handle treats that come in to celebrate, say, holidays and birthdays?
Well, sometimes parents do want to bring cupcakes or cookies, that sort of thing. We generally save those till the end of the day, like just before they go home, in case they're on a sugar rush, they get to go home with mom and dad. And we also, I don't personally serve any juice at my daycare. We just serve water and milk, so I don't want to add any sugar to their diet. About the sweetest things that I serve occasionally are like graham crackers or something like that. But we try to keep their snacks down to just healthy choices, fresh fruits and vegetables and crackers, that sort of thing.
Good.
That's great.
Yeah,
And that's
it
a
is.
good idea.
Absolutely. And as long as we have so many viewers watching, what a great way to celebrate a child's birthday by sending a book, sending stickers, sending something that's not edible and sweet. Okay. And you're our panel grandma. And so how are you helping care for teeth?
We give cookies.
Okay.
No, we brush their teeth after morning and then the evening, and then keep sweets down in the minimum, and then we give them water and juice. I do give them juice, but we keep it down, and try not to give them sodas. But there's always outside influences.
Sure there is. And one of our commercials for the show shows the circle of care, and where the child goes from parent to child care provider to a family friend, and and that he's getting juice and a cookie at each stop. And that does add up. But how great if you can have a toothbrushing at each stop.
Exactly.
That would be very nice.
That's really important for prevention.
Absolutely. Now, Dr. Sweeny, what are some of the mistakes that you see parents make with caring for teeth?
Well, I find that they don't create a big value for teeth, and they don't understand that they're really important and the child really needs them to be healthy. So they need really to be educated and to be taught that the teeth are really important. It's going to set them up for the rest of their lives.
Right. And we talked about even something as simple as the smile. And Dr. Sweeny, can you elaborate on how you said how the smile is so important?
Well, it's very important because when you as you get older, your smile does a lot for you. You're going to get a better job if you have a better smile. You're going to get a better date if you have a better smile. So it's really important. Besides, of course, your health.
Right.
So it's it's very important, and to really create a value for it.
Right. And I know as a teacher, too, I would see the children that were embarrassed of their teeth wouldn't answer
Right.
a question.
Of
Their
course.
confidence would...
Of course, their self-esteem, their confidence
right.
is affected also.
Okay.
Why would you want to talk if you have silver teeth?
Yes,
all in your mouth?
absolutely.
And it's not even the child's fault. It's the parents' fault for not helping the child.
Exactly.
Right. What can you address, please, thumb sucking? Because that's a myth, might be a myth, I don't know, where if you suck the thumb that you're going to push these teeth out?
Yes, actually, the pressure that the thumb sucking causes will cause changes in the growth and development of the child. So their jaws will look different, their teeth will be, come to a different position. So, but sometimes the child needs to suck their thumb for emotional reasons. So you kind of have to, know when is the right time to tell them not to do it. You have to kind of have a delicate balance between the thumb sucking and the physical effects that the thumb sucking can cause later on.
Okay. I want to ask you another question about the fluoride that we brought up in the last segment.
Yes.
Is that available over the counter? Is it prescription only? And how do we know if and when we even need it?
Right. By taking the child to the dentist will actually let you know if the child is not receiving enough fluoride, and the dentist will prescribe either fluoride tablets or rinses.
Okay.
Yes.
So it's prescription only.
Right.
Okay.
Right.
And Virtus, do you have an opportunity to talk to parents about dental care with the children?
If I see some evidence of neglect or some cavities, I definitely bring it to their attention. Occasionally we do have a child that needs some serious dental work, unfortunately, and it's very expensive these days, so we try to prevent that as much as possible and talk about healthy hygiene at home, because sometimes they're negligent about brushing their teeth, especially at night when they're going to be sleeping on that for several hours.
Right.
Absolutely.
Yeah.
Okay, terrific discussion. Thank you so much for your wisdom and advice.